Hi, everybody. We are live here for another show tonight with Dr. Kahn and BRT6HC from BRT6HC. And we're going to be talking to you guys about COVID-19, where we're at, what to look through for the summer, how the future's looking, all that fun stuff. So please join us. It shouldn't be too long. I know everyone's at the lake or hiding in their house in their AC or fighting that heat without AC, whatever you are doing, be safe, drink lots of water because, yeah, it's a scorcher out there. All right, you guys, we're going to get straight to it. I want to play a quick video here that is from BRT6 and just a quick little video of what they do. Go ahead, Bill.
Hello, everyone. I'm Connie. And I'm Chantel. And we are both registered nurses here in Little Pine First Nation. We are here to let you know we are taking the COVID vaccines mobile, which means we will be coming to you. How it works is our team comes to your home in a yellow or white van. One nurse will screen for allergies, consents, any health conditions. And one nurse will pre-fill COVID vaccine into syringes and prep the vaccine to administer to you at your home. We will also explain the vaccine, type that we're giving, the required number of doses, the side effects, and the treatment outcome. We will also stay and monitor you at your home for 15 to 30 minutes for any reactions and to keep you safe before we head on to the neighbor's house. So see you there. See you soon. Excellent.
And just like that, there's a video for Little Pine, I think there. I just seen a former staff member, coworker there, Janika. So hello, Janika, if you're watching. Anyway, you guys, come join us right now. We are going to be doing a quick update with Dr. Kahn and Bill Arnstan, and it's about COVID. If you guys still haven't gotten your shot and you still want to possibly get it, join this conversation right now. So I'm going to bring the gentleman on. So hello, Dr. Kahn. Hello, Bill. Oh, you got to unmute yourself there, Dr. Kahn. There you go. You're unmuted. You're good.
Good afternoon. Thank you, Nathan. Thank you, Bill. Good to see you guys.
Good evening, gentlemen. Thank you for having us again, Nathan.
Yeah, no problem. So we're just doing an update. We did go live 2 weeks ago. Was it 2 weeks ago or 3 weeks ago? I can't remember. 2 weeks ago, I think.
About 2 weeks ago.
Yeah, and we did talk about COVID-19. We talked about the Delta. We talked about a few other things, and there's some great questions as well in the comment section. So you guys keep that up. Ask away as many questions as you want in the comments, because we do have a doctor with us who can specifically answer them. And yeah, we'll all learn together. So without further ado, go ahead, whoever wants to start here.
Dr. Kahn, please.
Thank you very much. Good afternoon to everybody, Nathan and Bill and your team out there in the studio and in the communities. I know everybody had a very tough day, and this is the end of the day. So we really want to get on the key questions that are, in people's mind. So first of all, I want to thank everybody for doing an amazing job in terms of vaccination and responding to the COVID situation. The video was extremely impressive. Thank you so much for this beautiful video in which the nurses are going home door to door and providing vaccine. That is the best way to reach out to those people. So I really appreciate and commend you for those efforts that are taking place in the communities. I also want to, before we start, I also wanted to offer my heartfelt prayers and love and my best, wishes for the people in Cowessess First Nation. They are certainly going through some trauma with the unfortunate discovery of these unmarked graves. And so certainly our thoughts and our prayers are with the people in Cowessess First Nation and Kamloops. So certainly that is an acknowledgement I want to make. In terms of COVID, we are, as you know, in a very exciting stage in the response to the COVID situation. In the province as well as in our Indigenous communities, I will perhaps stick to the situation in our Indigenous communities, particularly in your areas. To date, the rollout of vaccine is strong, but we do need further push. Particularly in some population, we need first doses, and in some, we need push for the second doses. So as of June 28th, we have delivered, by we, I mean our nurses in the communities, our frontline staff across Saskatchewan unreserved communities have delivered 47,000, more than 47,000 vaccine doses, which speaks volume. I mean, this is not an easy job to do, but particularly now the option is that the nurses are going door to door, home to home, pop-up clinics, all sort of models of vaccine delivery are being, offered in the communities. On-site vaccines are being offered in different events, in different gatherings. So I think these are really good things that are happening. Communities are extremely busy. We have a range of communities. Communities have that reaching above 90% for first doses and reaching very excitingly, very fast the second doses. But also we have communities that are still struggling, lagging behind, particularly on the first and the second doses. So I think these sort of podcasts certainly would help them understand where we are and what can we do to get out of this pandemic. So just want to give you a quick understanding. Today we had a call with the Saskatchewan chiefs of communities, and we presented all sort of possible information on the COVID front, but also the most exciting thing is the vaccine uptake and the vaccine coverage. So 28% of First Nations 12 years and older are fully vaccinated. Currently, we are at 74% coverage for adults in First Nations that are 40 years of age. We are 64% for those aged 30 and over. We are 54% for those aged 18 and over, and 49% for all persons 12 years and older. So these are really an amazing milestones. Certainly, we are reaching the provincial target as well. For age 40, we are at 74% for First Nations. So I think there are really good signs and good recoveries, good deliveries in terms of the COVID vaccine. I feel like we have covered the elderly age group really well. There, I have no concern. We have covered other age groups as well. I mean, the 18-year-old and above certainly is catching up very quickly. My key concern is about one age group, which is the age group 18-year-old and under 49-year-old. These are our key, workers. These are our people who bring services and program, run businesses, and actually come to work. So in that particular age group, in some communities, that coverage is not very optimal. So I think we need to work harder to reach out to those people. And certainly the video that you showed is exactly the way we're going to reach out to these people. So if you go to a home where there are 10, 15 people living together, the elderly, the uncles, the kokum, the grandkids, everybody living together, certainly it has a big impact when the nurse is there, can address their questions. And mostly people who are hesitant because they need more information to boost their confidence. And their confidence will come with those in person, on site, one-to-one interactions and education and information sharing. So that is a very critical element in the vaccine uptake and, addressing the vaccine hesitancy. So that particular age group is the key target that we want to cover them before July 11th when everything will open up. So we will see people being more mobile, people will be traveling between the communities, between the provinces, and certainly borders are opening too. So certainly there will be a lot of travel. So if we have these unvaccinated or partially vaccinated people, certainly would pose a risk for further spread, further generation of these, variant of concern. So certainly the hospital in Regina and the hospital in Saskatoon primarily are filled up currently with the Delta variant cases. So that is the variant that actually primarily target or circulate among people who have either one dose or unvaccinated. So the people that are currently admitted in the hospital are those individuals. So to stop that, we are asking everybody to get their first shot if you haven't got it yet. And if you got the first shot and 21 days has passed, 28 days have passed, then certainly go for your second shot. And those shots are as easily available as you can imagine these days.
Awesome. Thank you, Dr. Kahn. Bill?
Thank you, Nathan. A couple of things on it. I just want to keep it fresh here with Dr. Kahn while he's still on. I see Brian Howard has a question. One of the questions I kind of have, Dr. Kahn, I believe I heard Premier Moe say today, a high percentage of the people who are getting COVID right now are people who are unvaccinated. And that the lowest number was people who have both doses. Have you heard anything about that, Dr. Kahn?
Yes, we saw the breakdown of that data. The data that they were presenting, particularly the COVID numbers are really on the declining trend in the communities. What we're going to really watch moving forward, the numbers in the hospitals, the number in the ICU. We would like to see who is being admitted in the hospital. And for someone to get admitted to the hospital, certainly they will be severe enough. So that is the number we really want to keep an eye on. So far, based on the data from this week, majority of these hospitalized cases are unvaccinated or partially vaccinated, in which you do expect that the virus will circulate. And particularly, we have seen wherever you have a growing or increasing number of second doses, the less Delta, the less other variants you're going to see. So that is what everybody's trying to message, that if you got your first shot, don't think you are fully protected, you are fully immune. I also hear some rumors out there in the community that if you had COVID yourself, then you need one shot, which is absolutely a misguidance, misinformation, and a very dangerous sort of information. So anyone who had COVID infection or not, we are advising both that they should get their second shot. We have seen the science telling us that the immunity that comes from the second dose or the immunity that comes from the vaccine is more robust than your natural immunity that you acquire or you develop from in a natural infection.
Awesome. Thank you. I have a quick question. I don't know. Well, here we'll answer. I don't know. It's not a COVID question. Should we answer it? I don't know.
Go ahead.
It's kind of cool. We'll answer it. Well, you'll answer it. He wants to know, is Myrna, how close is the technology, or how successful has it been in testing for its original purpose, cancer drug delivery?
Nathan, I don't understand the question completely, but I will answer it the way I understand the question. So if the question is about the effectiveness of vaccine, and particularly mRNA vaccine in people who had cancer, is that the one that I'm understanding?
Yeah, it's like, how close is the technology, or how successful has it been in testing for? Well, he wants to know, basically, it was originally made for cancer, a drug delivery. Like, how is it doing, I guess, for that purpose, like, I guess.
Oh, yeah. Okay. So this particular mRNA vaccine, we're talking about the COVID vaccine, is particularly targeted at the COVID virus, which is an infectious disease developed or brought by a virus. Okay. So there is a distinction that this particular mRNA vaccine is targeted at the virus, this particular COVID virus or the COVID variant. So for those sort of COVID variants, the mRNA vaccine for the COVID infection is certainly very effective in terms of preventing the symptomatic infection also very effective in slowing or stopping the further spread, but also hospitalization and death. So for the COVID purposes, the vaccine is perfect. It's the best vaccine for the COVID situation. If you're asking whether similar technology will be used for the cancer treatment and cancer prevention, certainly there are a lot of different types of cancer. Some cancer are caused by a virus. So certainly there is a lot of thinking about how this technology or other technology can be used to create a best prevention for chronic, invasive conditions, cancer including that. So certainly future will tell, but certainly there is a lot of research currently in progress on that.
Awesome. Harry, you just kind of chimed in there again. Thank you for those questions there, Brian. That's very interesting, actually. I actually have a question. Can you mix vaccines? I know we didn't. Did we touch on that? No, we didn't, eh?
No, we didn't.
So I've been seeing in the news about, people are asking, can you actually mix these vaccines? Moderna, Pfizer, and I don't know how many more are out there, but are you allowed, or can you, or is it going to harm you?
Yes. And I can speak to that, Nathan. First of all, everybody in this pandemic has seen that everything we did in response to this COVID, whether it's the COVID infection or the virus, protection, prevention, hospitalization, clinical treatment, and then vaccine, everything was based on the evidence that science actually brought together from an unprecedented international scientific collaboration. So you have seen that, it is the new phases of the COVID-19 pandemic emerge, so was the science and so was the changing directions. So the latest science says that particularly the mRNA vaccine, they are similar in nature, like the Moderna and the Pfizer. So there was a lot of growing evidence, and we were waiting for the clinical trials in Israel and UK and many parts of the world. When those information came to light or to the public domain, certainly the decision was quickly changed. Initially, those vaccines were not interchangeable, but as the evidence became available, the first evidence that came was that, yes, both mRNA vaccine, Moderna and Pfizer, are of the same nature. They function the same way somehow, and they create similar immunity. So the evidence was quite robust and quite convincing that, yes, the Moderna and Pfizer are interchangeable. So that was the first thing that happened. Then the second was AstraZeneca is also a COVID-targeted vaccine, but the way it generate immune response was different than the mRNA response. So then the second set of evidence that came actually also proved that, yes, you can interchange between AstraZeneca and the mRNA vaccine. So that was another set of evidence that came. And currently, we are practicing under those premises and under those scientific guidelines that anybody who had initially received AstraZeneca, if they prefer to get the second dose of AstraZeneca, of course they can get it. But if AstraZeneca, people have changed their mind, they want to go for mRNA vaccine, certainly that is possible now. And the same is valid for the mRNA vaccine. So if you initially got Pfizer vaccine, you can certainly get the Pfizer vaccine as a second dose. But if Pfizer vaccine is not available, you can get a Moderna vaccine. The vaccine effectiveness and the immune response in the body will be as you would have received from the same vaccine. So yes, there is a quite convincing evidence now that vaccine can be interchanged. And this interchangeability practice is not something new to us in public health. Many other vaccines are also being changed. When we give hepatitis B vaccine, if you don't have one brand, you can give another brand. So that happened actually even before COVID vaccine was developed. So that interchangeability still happens in many ways. Public just didn't know that, but I think COVID brought everything to public light. So now in Saskatchewan, yes, interchangeability is possible. It is happening. Anybody can switch from one dose of vaccine to another brand of vaccine.
Awesome. Sorry there, Bill. Thank you, Dr. Kahn. Yeah, because I was wondering that, my daughter, who is 12 years old, got the first one and received Pfizer. And I know you're coming here shortly. I wanted to get her second one. So just in case everything runs out, because you hear there's shortages, or we might miss a date or something like that. So going around North Battleford, Bill, this one's going to be for you. What are the dates right now that you guys are administering for urban people to come and get their second shot? And is there a second shot? Is it a specific second shot, or is it just the same drug, but it's like you're calling it just your second shot?
It's the same vaccine.
Okay.
Again, like Dr. Kahn had just mentioned, if you had got, we can mix and match them. But we are giving Pfizer. Battle River Treaty 6 Health has a large supply of Pfizer right now. So we are pushing as much vaccine as we can. We're not turning anybody away as long as their second dose is 21 days after their first. They just have to phone our COVID line, make an appointment, and we'll make arrangements for them to get their doses. Or they can show up at one of the community vaccination clinics that they're having weekly. If you are urban, BATC does have their urban one, if you fall in that criteria. If not, get a hold of our COVID line at 937-6749, and they'll give you directions to where and when you can get your shots as quickly as possible.
Awesome. So in UK right now, I read this in the news yesterday, or no, maybe the day before. There is a massive 20,000 plus breakout right now of the Delta, and everyone's getting worried again. Okay, let's fast forward. Let's say it's September. Canada, whatever provinces you're in, same thing, because I know come July 1st, Alberta's opening up. Come July 11th, Saskatchewan's opening up. I don't know what's going on with the other provinces, but I know everyone's just starting to act like it's not here anymore, because just kind of how same thing happened last summer or around May, because everyone was just getting antsy to get out and do something. June, it kind of just laxed, and then July and August came. Everyone was like, no, nothing's going on. September, the wave came. October, blah, blah. Are we heading for that just because now it's already happening in the UK? Are we looking forward and going to see what wave would we be on? Would this be the fifth wave? This would be the fifth wave, right?
Wave? It depends on how you count it. Yeah.
So are we heading towards that just because now what we're seeing in the UK? Because I don't even know if the UK has laxed their rules like kind of how we are. I don't know what's going on over there, but let's just say perhaps they are, or they did. Is this what we have to look forward to?
Yeah, good question, and I hope I'll answer it all from all angles. So first of all, Saskatchewan very much follow the UK guideline, the UK sort of approach. So all along we have been watching and monitoring the UK situation, and then basically our response has been very similar to UK. Certainly, yes, you're right. They had a few hiccups in terms of a little bit of premature opening and quite rapid opening. And as you know, UK is a very different country than Canada. There is a lot of overcrowding. There are a lot of people in a very small place. And so certainly those dynamics play a role. And yes, they did delay some of their reopen plans based on their Delta variant circulation, and outbreaks were generated by the Delta. So certainly they delayed their reopening plan by a couple of weeks. So yes, those situations are certainly something to watch. In the US, 20% of the cases, the new cases in the United States, which has a very, very high vaccine coverage rate in the world, 20% of their cases are, variant of concern, and particularly Delta. So we are watching all those dynamics in those countries. And Saskatchewan is also very cautious. I mean, some of our milestone or some of our targets for step 1, step 2, step 3 are extremely ambitious and quite good indicators. So as the Premier mentioned today, in mid-July or end of July, we will reach those targets for step 3. And certainly we hope that that doesn't happen in Saskatchewan or in Canada, what has happened in UK, but still they are equally targeting the virus with the second doses of vaccine. They're very much focusing their efforts on expediting the second doses in their communities or in their jurisdictions. We do know there are some modeling information that came from the Public Health Agency of Canada, but in Saskatchewan, the University of Saskatchewan also has been modeling the COVID data for us, and they do give us early warnings in Saskatchewan. So based on the recent PHAC modeling for the fall, and based on the recent Saskatchewan data of modeling for Saskatchewan, there is a likelihood or a possibility we're gonna see flare up of cases as we move into this fall, is because still there will be pockets of unvaccinated people that may boost those flare up. So if we achieve 85% or 90%, which is that target for that herd immunity, if we went above that, perhaps we would not be in those situations where US is or where UK is. There's quite an optimism there that we will achieve these targets, and we may not see, but there will be sporadic cases of COVID, the variant of concern. There will be sporadic cases of flu and rhinoviruses. I mean, we have seen some cases in other jurisdictions. These respiratory pathogens are coming, and certainly the cough and cough seasons is usually there in the fall. So that's going to be an interesting dynamics to see how COVID, flu, and other respiratory viral pathogens are going to interact, and in a population which is 80% or above immunized. So that's going to be an interesting dynamics to watch. Certainly, the focus in the coming months would be that we keep reminding people about second doses, keep reminding people about hand hygiene, more outdoor than indoor sort of interactions, and hand washing, not touching the face, and testing. Certainly would be something when the kids come back to the schools in the fall. We are doing our best to have a very robust system of testing in the fall when the kids come back to school, so that we can detect whether it's the flu activity or any other respiratory pathogen that usually circulate in population in the fall, so that we have testing abilities that we can test. We would still be, the public health order is going to be ending July 11th, but COVID is not ending. We keep seeing that is maybe the end as a public health order or these restrictions, but COVID is going to be still around. And all of us need to learn, and we have learned that already, but I think we need some more learning and more understanding and more sort of adherence with some of these precautions, that we are very strong in terms of living with COVID in the fall, like the way we are dealing with measles, pertussis, and influenza, and those sort of viral infections. So that is something we need to be watching and monitoring in the coming months.
Awesome. Thank you. Because and here's the other question. Is there a plan come September if everything just falls apart and we're back to square one? Is there a plan from the medical side? I don't know if the political side, well, I think they're just going to follow obviously what you guys say, but is there a plan? Like, I just want to know, we got to kind of might be expecting, I'm just preparing for the worst here, because, I work at a school and we haven't had kids for a year and a half, which is just mentally draining. I'm trying to go to work and, prepare, and, you got no kids there and stuff. So everybody else as well. So what are we actually looking forward to, in your guys' opinion? Let's just say Plan C is here. What are we doing with
So,
Plan C?
so first of all, the good thing is that the COVID vaccine is extremely effective. It's more effective than any other vaccine we know. It's more effective than the flu vaccine. That is one very reassuring thing.
Yeah.
So if we have a higher rates of second doses and we go above 80 and 90, there is a good evidence that we're not going to see COVID, and the COVID would not be a threat for our health system, and we would not be going to those situations that you have to shut down, businesses, and shut down cities and restrict people movement. That is perhaps is very unlikely to happen because the COVID vaccine is very effective. And there is a growing evidence that initially they said the COVID vaccine worked for more than 3 months. Now they say it works it gives you immunity for more than 6 months. And there is even more evidence that the COVID vaccine may provide even long-term protection. Whether we would be able to prevent another wave, whatever wave you may call, with another booster shot, that's also something that we're watching that may happen or may not. So certainly it will depend on, there's a very strict monitoring on the COVID surveillance, very strict monitoring. So it's not that post July 11th, we'll stop testing, we will stop monitoring. No, there is going to be very strict monitoring, but monitoring this pandemic in a different way. Like, as I mentioned, we will be watching more hospitalization, more looking at every case that is hospitalized, that we understand where this case came from, was that case vaccinated or not. So understanding those dynamics, the likelihood of shutting down again and putting lockdown and those sort of things is very, very unlikely. What we would need to do is to watch, monitor, test more, and see the effectiveness of vaccine, how long it lasts, and whether we would need a booster sort of dose around Christmas time and in the new year. That is another thing we need to watch. So certainly there's a lot of monitoring. Just to rest you assured that that monitoring is not going away. That early warning system is not going away. That tells you what steps you need to take. So I think that will be there. That will help us take the immediate step to stop the spread, or whatever the new version of this virus may emerge. Certainly there will be steps taken in a timely way. There is a lot of watch on that. So certainly that is not going away.
Absolutely. Thank you, Doctor. Like you were saying, Nathan, everybody's seeing the light at the end of the tunnel right now, and they're thinking it's a green light, good to go, do what we're going to do. And, I've been telling our communities and our staff that light is still yellow. It's caution. Do what we're doing, masking, washing hands, physically distancing from each other. We're not out of this fight. COVID's not done. We're still right in the middle of this fight. And, with everybody thinking we have a green light to do what we can just do, it's putting a damper on our fight. It's starting to tie one of our hands behind our backs. But we're going to do everything we can to continue, right? I mean, I'm staying positive about this. We're going to get ahead of it. We are ahead of it. We're going to stay there right now.
And, so there'll be monitoring. There will be a lot of watch. And if the public, there is such a global vigilance on this, and everybody has learned so much. Those lessons learned is going to be around us. Just imagine how much have we learned as a population, as a global community about, hand washing and masking and distancing. Without COVID vaccine, we were able to dent the curve and bring it flat or bring it down. So I think there are so many valuable lessons learned. People are very vigilant. They are paying attention. And if any flare-up would happen, it will be immediately and very quickly communicated, and steps will be taken. But I think vaccine is the biggest hope. And I think as we are rolling out this vaccine, there is a lot of research on the vaccine in itself, that whether this vaccine is good enough, for how long, and for how many variants can it cover, and whether the way we change the flu vaccine every year, I mean, the reason we are asked to go for a flu shot every year is because every year the vaccine that is brought to the population actually is reflective of what strains of the virus is circulating. So that's going to be the same sort of phenomena for COVID as well. Whether we will have a combined vaccine for flu and COVID together, or we would have separate vaccine, or we may eliminate COVID like from the roots, and we may not see it at all. So I think there's a lot of possibilities in the future.
Yeah, no, it does feel, and at the same time too, a lot of the because of programs like this and what BRT6 is doing, and Dr. Kahn's and everyone else putting out the information out there is everyone's pretty much educated now. It's like when you are around a case or something happens, it's like almost second instinct is starting to kick in of what we got to do to prevent it's spreading, or even, you know what I mean? There's no sense of panic now. It's kind of like, okay, these are the steps. We already know what to do. Obviously, we got to keep pushing it, and so it's kind of ingrained. But yeah, just want to get there where we are sliding in the home plate, and obviously back to normal as much as we can. So
one thing I've been hearing, Dr. Kahn, is a lot of people are doing interprovincial travel. That raises some concerns with me. What are your thoughts around that?
Yeah, so that is a very good question, and that has to be like on top of mind coming in the coming days and weeks, because people will be traveling. It's a long weekend. People will be traveling. People need to travel, and people have a lot of needs, and that's all fair. The problem is that every province, travel, nobody's stopping anybody from traveling to another province. People can travel wherever they want. It was allowed previously, it is allowed now. The only thing that I would caution people and advise people to, first of all, before you leave your house, are going to another mall or another province, or for whatever reason, whether you will stay indoor or outdoor, that you make sure that you have received 2 shots. And before you leave the house, that you have passed that 3 to 4 weeks have passed post your second dose. So that's where you can really confidently say, I'm fully immune. I'm fully vaccinated. If you just got the second shot today and the next day you travel to Manitoba or anything else, that's a big risk you're taking. So that is number one, that you make sure that 3 to 4 weeks have passed post your second dose, and then you travel. Second, if you travel, make sure that whatever environment are you going to, if you're going to a party or a casino or indoor or sports or business, and make sure that some of these good habits that we have. The reason we have 0 cases of flu is because everybody was wearing a mask, everybody was hand washing all the time, and people were staying home if they were sick. The same sort of rules will still apply after the second dose if you're traveling. And if you have symptoms, if you have developed symptoms while traveling or on arrival or on departure, stay home. But if you are arriving and have symptoms, isolate yourself at home, call the health line, get tested, sort it out, whether it's the COVID, whether it's the respiratory syncytial virus or influenza virus or rhinovirus or whatever virus. So I think that testing component still will be around, and people need to use that as much as they can, especially people who are immunocompromised, elderly people, people on dialysis, cancer patients, diabetic patients. Those people with second dose, I would suggest they should still observe precautions by wearing a mask indoor. If you're going to an environment you don't know who is vaccinated, who is not, I would suggest wear a mask and keep a distance. Even if you have 2 doses and you're vulnerable, you're immunocompromised, you may not have launched that adequate immunity yet, or you may still be vulnerable. So those sort of precautions and advices and tips will still be very valuable in terms of protecting yourself and protecting your family. And just washing hands, those are really good habits, not only for respiratory, but it also save you from diarrhea and many other things. So I think these are really good habits, and people need to keep those habits and don't give up the good habits we got that protected us so much during this pandemic.
Thank you for that. Yeah, no, I'm actually taking off tomorrow myself. So yeah, it's good to know that I won't have, I still got to be cautious, but can relax a little bit like that. So yeah, I know we're all battling the heat here right now, and well, we're in AC. I don't know about you guys, but if you're not, pray for you. But as I guess we should possibly, unless there's any questions in the audience, you guys, or if there's kind of some more subjects you wanted to touch up on, going forward, or did we miss anything?
I just wanted to say that every one of us has an influence. If you are a dad, if you're an uncle, if you're a granddad, if you're a kokum, whoever you are in your family or in your community, any position you are in, every one of us has a very influence on our families and can play that role and protect everybody, protect yourself, protect everybody by getting your shots and observing these precautions. And do enjoy. It's a good summer. It's a beautiful summer. We live in Saskatchewan, and we're also very fortunate. Many countries, like there are 7-8 billion people, and hardly 2 billion people have received the vaccine. So we're very fortunate that we were able to get some of the best vaccine in the world, like Pfizer, Moderna. In our First Nations communities, these were the only two vaccines we have given primarily to everybody. I mean, there was some AstraZeneca, but I think primarily the one of the best vaccines were available. Fridges are still full. Nurses are actually just waiting, counting on everybody to come forward and get the vaccine. And it just takes a lot of their time going door to door. If you can bring your entire family to the clinic, book yourself. Vaccine is available on booking, on pop-up clinics in so many different ways. And we're very lucky we have the vaccine. And we have still plenty of vaccine. And I'm glad that Bill and his team is going to be still keeping the clinic open, the urban clinic open, I think till the end of July, right?
Yeah, I believe that one is open till the end of July. Yes.
Yeah. So I think your clinics are open. If you're shopping off reserve in a town, you have the opportunity. If you are in town or if you are in the community, nurses are there. This is the best protection. Enjoy your life and have fun and have the best of this summer by protecting yourself and protecting your family.
Absolutely.
Thank you, Dr. Kahn. Bill?
So, Dr. Kahn, I was fortunate enough to be on that mobile door-to-door clinic on Little Pine working with that team. And one of the things that we come up a couple of times was expectant mothers. And they would have questions around the vaccine. Our nurses handled it very well, very professionally, because they are extremely educated on what the protocols are. But for any of our listeners here, for expectant mothers or mothers who are breastfeeding, is getting the vaccine acceptable?
Absolutely. For Pfizer vaccine and Moderna vaccine has the best records, evidence of safety in pregnant women and breastfeeding women. So I think it's perfectly safe. It's given everywhere around the world. Here in our communities, I think it's perfectly safe. I think there is only one contraindication to the vaccine. The rest, in every situation, vaccine is permissible, vaccine is effective. And that is that unless you had a severe allergic reaction to the vaccine, other than that, in almost all conditions that you can imagine, autoimmune diseases, infectious diseases, cancer, is just a matter of best timing. That is perhaps the only thing that the nurses and the doctors would do. If you are on a cancer treatment, if you are on a treatment for autoimmune disease or lupus and all those sort of things, if you are using performance enhancing drugs, if you are on dialysis, if you are a transplant patient, imagine any conditions, you are perfectly safe to get the vaccine. It just needs to be adjusted with the timing. So the nurses would look at the timing of your treatment, your medication, and they will still, the benefits are still more than the risks, and they will still advise you to get the vaccine. So yes, vaccine is perfectly safe. And if you are on any medication that you think may interact with the vaccine, it's just a matter of timing. They can stop the medication temporarily till you get the vaccine. And then once you develop that immunity, get back on your medication. So I think that's what the nurses or the doctors would do, that they will just look at the timing, that, what is the best time for you to get the vaccine. So in almost all conditions, the vaccine is effective. There's a very good records and safety profile for pregnant women. And certainly, everything is being watched and monitored. So for anybody who has any risk conditions, they will be asked to stay a little bit longer for more than 15 minutes. The nurses will hang around for more than 15 minutes just to see if you had any sort of side effects or whatever. But so far, we have not seen any major side effects, just milder side effects. I got my vaccine. My admin assistant, who is a 70-year-old, got the vaccine. Both of us felt absolutely normal and fine. So that's what I'm hearing from majority of people. And certainly, if you have any sort of questions, talk it through with your doctor and nurse. And if you know anybody that has on certain medication and have questions, certainly put that to the nurse. The nurse will actually connect with us on a daily basis. And then in some situation, we go to the specialist, to the healthcare providers, to the cancer doctor, to the dialysis physicians, to the transplant doctors, and we get their permission that we are going ahead with vaccine. And we put that in record, and then we advise the patient accordingly. So I think it's perfectly safe and no worry about it.
Awesome. Thank you, Dr. Kahn. Oh, it looks like, Bill, you ready for another question? It looks like.
Yeah, no, I was actually going to just thank the doctor as well. And just when we're doing the vaccination clinics, we have a full anaphylaxis team there. We have all the equipment, all the safety equipment. If somebody does have a reaction, we are all prepared and good to go. We've given just about 2,100 vaccinations here at Battle River Treaty 6, and we have not had a single major reaction. Like the doctor was saying, sore arms, some headaches, some sleepiness, what we're hearing everywhere. We haven't had anybody need medical attention. A couple of people that needle anxiety. We've dealt with that. Lots of people are scared of needles. I know I used to be.
That's me.
It's like, oh no, she's gonna stab me type thing with that needle.
Yeah, no, I was same thing, man. I don't know why I got a fear of needles just later in my life. It's kind of like you don't like watching scary movies when you're old. I don't know why. I don't like it. Same thing with the needles. So there you guys go. We've given you a lot of information these last two podcasts. And these vaccines are still going to be going on till the end of July, but continue on after that. Obviously, I think just the clinics are going to be closing in July.
That was that BATC urban one that they're running with in partnership with the SHA at the Decker Center. Okay. That one's running till the end of July. Battle River Treaty 6 Health, we're not stopping. We're going to do on community every day. We're also going to have the opportunity to do it here in town. And if the need arises, we will continue to do urban clinics.
Nice. Yeah, I mean, that's basically whatever, because I remember my cousin and a couple other people were actually the other day where you could actually still get your vaccine. And I knew you guys were putting on one in BATC. So anytime after July and you're still, you're finally ready, BRT6HC is the place to go and get your vaccine if you can't find anything in your community. Are you guys just taking anybody? It doesn't matter, right?
Yeah, pretty much. At this point, we have enough vaccine that we are not turning away anybody.
So there you guys go. If you know somebody and they are worried, they'll have Dr. Kahn answer questions, hopefully. But for sure, Bill Ironstan and his team can take any questions you guys have with no fear. After I know I went in there, my daughter, who was 12 years old, didn't want to go in, and we sat her down and talked her through it, and then the team also assured her everything would be okay. And sure enough, in and out, man. Like, I think we were in there for like 20 minutes because you got to sit down for 15 minutes after and wait it out. But I mean, she's good to go. She's ready to get her second shot. None of us have 15 arms yet. We're good. So please don't believe anything you see on Facebook. If it's crazy, if the Bill Gates theory kicks in, or aliens are going to come knocking on your door, or, you're going to be magnetized and your glasses won't fall from your cheek or your quarter. Go shower because you're probably just hot and sticky. That's probably why it's staying there. Just don't pay attention to anything. If you guys really want to get to know any questions, get a hold of Bill and his team. Call them. If you can somehow get a hold of Dr. Kahn, hey, ask him too. But go to your doctors. Ask people that know exactly what is going on with this vaccine and know they're not paid scientists by Bill Gates or anybody to give the answers you think you need to hear. These are guys that care about you, and they got into the field for a purpose, and to help out humanity, not help one person who's a billionaire control the world. So, I have to say that because that is exactly what some people say. It's funny, but it's true. You get a lot of people out there that think this way, and hats off to you if you don't want to take it. Be strong. We really hope the best for you, that COVID doesn't, if you do get it, that it doesn't really damage you. You're just kind of get over it and you go on with your life. If you don't want, that's your choice. That's your choice. What we're just trying to say is the vaccine here is here to help. And if you do catch COVID with the vaccine, you're far more likely to get through it with more ease than without it. So, with that, I want to know if you guys want to close out and say something.
Yeah, absolutely. Thank you, Nathan. Kind of a segue into Dr. Kahn to finish up here. With the vaccine, there used to be polio and whooping cough and all other types of diseases back in the 50s and 60s that literally many children would die from. The vaccines were made, and for those diseases they were given, and we don't hear polio in North America. It's a rare thing. Many of the diseases that you're vaccinated as a child for, when you go through your community health nurse or your public health nurse, they're very rare. My grandchildren go for their needle sets, right? The 3 month, 6 month, all that. So the vaccine is safe. It's done for the right purpose. It's done for humanity. We're trying to keep everybody safe, and we're trying to beat this thing. People worry that you're going to get tracked. You got a cell phone, you got a car, you got a computer, you're being tracked. It's not in the vaccine, right? But first of all, honestly, I work with an amazing health team here. It's a big health team, right from the people that open the doors in the morning to the people who cut the checks to the directors who do that. But most of all, I want to do a shout out to our nurses. I've worked with them side by side, shoulder to shoulder, watched them put those needles in people's arms, comfort people that have anxieties, give people the message, the truth, and get them vaccinated. And I know how much they work. If people honestly knew how much overtime these nurses are putting in, contact tracing, extra clinics, travel, things like that, it is an incredible amount. And our team's just plugging through without burnout. They're just going hard, and my hat's off to all these nurses that we work with, and to Dr. Kahn and his team at ISC, right? Dr. Kahn is one of the most knowledgeable men I've met. I'm glad that I know him. Honestly, our First Nations in Saskatchewan, we probably wouldn't have got through this as well as we are without Dr. Kahn's kindness, professionalism, and knowledge. So, Dr. Kahn, sir, I want to give you a heartfelt thank you to you and your team.
Thank you so much. Thank you so much. That means a lot to me. Thank you so much. And just one last word, Nathan, that
go ahead.
I think Bill said it really well, and I can't say it better than him, that, this is a battle. Everybody played their role. And I think we're not done till we vaccinate our children in the fall. And that is coming also very quickly, that we would have to offer the vaccine to under 12-year-olds. So just stay tuned for that. And certainly we can do another podcast as you need. And I really want to thank you for this incredible effort. And I'm sure it will help. And certainly we can do more of that. So thank you very much, and very, very happy to be with you.
Awesome. Well, thank you, Dr. Kahn and Bill. Dr. Kahn, I'm going to say I think you could have your own podcast. You're quite informative, and how you answer the question. So thank you again. I for sure will do this again. But you guys out there, get a hold of BRT6 if you guys have any more questions about it. Just get your vaccine if you can. summer's here. We want to just enjoy life and have fun and beat the heat at the lake right beside people without worrying about anything else, except how you're not going to get a bad tan. But with that, you guys, we're out of here. We'll let you know if we're going to be doing this again. So we'll see you possibly down the line, but have a great summer. Stay safe, and we'll see you.